Hi, hello everyone. Today we will discuss the topic kidneys. Kidneys, ureter, urinary bladder, and urethra together form urinary system. Kidneys are present and seen in the anterior view. They are the bean-shaped organs, and the right side kidney is present lower than the left side kidney because of the liver. Both the kidneys start at T12 vertebra, but the right ends at L3 vertebra and the left ends at L2 vertebra. Kidney has three main functions. One is plasma filtration, the second one is acid-base balance, and the third one is excretion of the waste products. These all three functions will be done by the kidney with the help of the nephron. The head of the nephron is called as renal corpuscle, which primarily filtrates the plasma. When we take a whole blood sample and it is centrifuged, the whole blood is divided into three parts. One is plasma, the other is buffy coat, and the other is red blood cells. Plasma is filtered by renal corpuscles. Plasma consists of water, proteins, nutrients, electrolytes, metabolic waste like ammonia, uric acid, urea, and creatine, and very few amino acids. These metabolic wastes are excreted through renal corpuscle. It is dangerous if these waste products are too much. Body is in perfect state. It is balanced between the acid and base at a range of 7.35 to 7.45 pH. It is the normal state. Sometimes, due to varied reasons, it may become acidic or alkaline, and the conditions are called as acidosis or alkalosis. If pH gets more deviated, it is regulated by our primary organs, lungs, and kidneys. If they are not regulated, it may lead to death. In addition to these functions, kidney also helps in hormone production, erythropoietin, and vitamin D metabolism. Kidney is roughly 120 to 200 grams in weight and 10 to 13 centimeters long, 5 to 6 centimeters wide, and 4 centimeters thick. Kidney has two poles, inferior pole and superior pole. A suprarenal gland will be present on the superior pole of the each kidney, and kidney has two margins, lateral border and medial border. Medial border has hilum in it, where the structures from the kidney can go in and out. The structures that come in or go in and go out from the hilum are blood vessels, nerves, lymphatic vessels, and as well as ureter. In the posterior view, if we take a transfer kit and see from the superior view, we have two kidneys, a vertebra, and in front of them there will be two vessels, abdominal aorta and inferior vena cava. First covering around the kidney is called as fibrous capsule. Around this fibrous capsule there will be a adipose capsule called as perinephric fat, and the capsule is thick posteriorly than anteriorly, and this will help us in preventing any concussion to the kidneys. Externally to fat there is renal fascia, which has two layers, anterior layer and the posterior layer. This anterior layer and posterior layer will fuse laterally, and the posterior layers fuse in front of the vertebra. Both the anterior layers go in front of the blood vessels and fuse there. Anterior layer will form prerenal layer, also called as fascia of Tolt, and posterior layer forms retrorenal layer, or also called as fascia of Zuckerland. Both lie behind the peritoneum.